Hi, I'm Garvin. This telecast is on Eucardic. So what is Eucardic used for? It's used for chronic, stable heart failure, in addition to standard medicines used to treat heart failure. It's also used for angina pectoris as a regular treatment to prevent heart attacks, and it's also used for high blood pressure or hypertension. So how does Eucardic work? So Eucardic, or the chemical ingredient Carvedilol, is a type of medicine called a beta blocker. Beta blockers work by blocking beta receptors that are found in various parts of the body, including the heart. Blocking the beta receptors prevents the action of two hormones that are produced naturally by the body, called noradrenaline and adrenaline. These hormones are often referred to as the fight or flight chemicals because they are responsible for the body's reaction to stressful situations. Eucardic blocks beta receptors that are found in the heart. This reduces the action of adrenaline and noradrenaline on the heart, causing it to beat more slowly and with less force. In turn, this reduces the pressure at which the blood is pumped out of the heart and around the body, which helps to reduce blood pressure. Eucardic can therefore be used to lower high blood pressure. Eucardic's action in slowing the rate and force of the heartbeat also reduces the energy used by the heart to pump blood around the body. This reduces the heart's need for oxygen, which means Eucardic can also be used in the management of angina. Angina is chest pain that occurs because the heart does not get enough oxygen to meet demand, for example during exercise. This is usually as a result of hardening or narrowing of the arteries that supply blood to the heart. Eucardic reduces the workload of the heart and so decreases the amount of oxygen that it needs to pump blood around the body. This helps to prevent attacks of angina. Eucardic also blocks receptors called alpha receptors that are present on the walls of blood vessels, which causes them to widen. This reduces the resistance in the blood vessels, allows more blood to reach the heart, and reduces the effort required by the heart. All the actions I've described above decrease the effort that the heart needs to pump blood around the body. This means Eucardic can be used to treat chronic heart failure, where the pumping action of the heart has become less effective. Eucardic is used in addition to standard heart failure medicines such as ACE inhibitors, diuretics and digoxin. So how do you take Eucardic? Eucardic tablets should be swallowed with a drink of water. If you're taking this medicine for chronic heart failure, then you should take the tablets with food. The dose prescribed and how often the medicine needs to be taken depends on the condition being treated. The tablets are usually taken once or twice daily. It is important to follow the instructions given by your doctor and printed on the label of the pharmacy box. Try to always take your dose at the same times. This will help you remember to take them. If you forget to take a dose, take it as soon as you remember, unless it is almost time to take your next dose. In this case, skip the missed dose and take your next dose when it is due. Do not take a double dose to make up for an earlier missed dose. It is important that you don't suddenly stop taking this medicine unless your doctor tells you to. It's to be used with caution in elderly people, people with decreased kidney function, people with a history of heart failure or a weak heart. Slowed conduction of electrical messages between the chambers of the heart, which is first-degree heart block. A severe form of chest pain not caused by exertion. Conditions involving poor blood circulation in the arteries of the extremities for the hands and feet, which is peripheral arterial disorders such as Raynaud's syndrome or intermittent claudication. Also diabetes. This medicine may mask the symptoms of low blood sugar, such as increased heart rate and tremor, and the dose of your diabetes medicine may need adjusting. People with a sudden history or a history of sudden drops in blood sugar levels, hypoglycemia, overactive thyroid gland, this medicine may mask the symptoms of thyroid storm or thyrotoxicis, abnormal muscle weakness, which is myasthenia gravis. People with a history of allergies, beta blockers may increase sensitivity to allergens and result in more serious allergic reactions. They may also reduce the response to adrenaline used to treat anaphylactic shock, and also psoriasis. So for pregnancy and breastfeeding, the manufacturer states that this medicine should not be used during pregnancy unless considered essential by your doctor. Beta blockers reduce blood flow to the placenta, which could increase the chance of premature delivery or death of the fetus. They may also slow the baby's heartbeat, cause its blood sugar to drop, or restrict its growth in the womb. If you think you could be pregnant while taking this medicine or want to try for a baby, it is important to seek medical advice from your doctor. It is important that you don't stop taking this medicine suddenly. This medicine may pass into breast milk in small amounts, as this could potentially cause the baby's heart rate to slow down or its blood sugar to fall. It is recommended that this medicine is not used by breastfeeding mothers. Again, seek medical advice from your doctor. So the main side effects would be feeling tired, dizziness, headache, low blood pressure, decreased ability of the heart to pump blood efficiently, chest infections, urinary tract infections, slower than normal heartbeat, fluid retention, weight gain, raised cholesterol levels, changes in blood sugar, particularly in people with diabetes, depression, dry or irritated eyes, visual disturbances, drop in blood pressure when moving from a lying or sitting position to sitting or standing, which may cause dizziness, lightheadedness or fainting, cold hands and feet. The side effects listed may not include all of the side effects reported by the manufacturer. So for more information about any other possible risks associated with this medicine, please read the information provided with the medicine or talk to your doctor or pharmacist. So how can this medicine affect other medicines? It is important to tell your doctor or pharmacist what medicines you are already taking, including those bought without a prescription and herbal medicines, before you start treatment with this medicine. Similarly, check with your doctor or pharmacist before taking any new medicines while taking this one to make sure that the combination is safe. So Eucardic is likely to have an additive effect with other medicines that decrease blood pressure, particularly medicines that are used to treat high blood pressure, which would be antihypertensives. This may cause dizziness, which can usually be relieved by lying down until the symptoms pass. If you feel dizzy while taking this medicine in combination with other medicines that can lower blood pressure, you should let your doctor know, as your doses may need adjusting. This medicine may reduce the blood sugar lowering effect of some medicines used to treat diabetes. So people with diabetes should carefully monitor their blood sugar while taking this medicine, as Eucardic can also mask some of the signs of low blood sugar, such as increased heart rate and tremor. So if you have any questions, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.